So a few radiobiology questions. Here, the first one over here is typical shape of tumor growth curve is obviously Gompezian. And this next one, for conventional fractionation, the tolerance dose for a particular normal tissue complication is found to be 30 gray. If a patient is treated with a drug that has a dose reduction factor of 1.3, then the new tolerance dose for this tissue would be roughly. So dose reduction factor, as we know, is the tolerance dose with the drug and the tolerance dose without the drug. We need to find the tolerance dose with the drug. So this over here, we are multiplying the dose with the drug equals dose reduction factor into dose without the drug. So dose reduction factor is 1.3 into 30 gives us 30 into 1.3 gives us 39. So the answer is E. Next one, the TCD 90, that is tumor control dose for 90 for a series of 0.1 centimeter diameter tumors receiving fractionated radiotherapy in 1.8 gray daily fractions was determined to be 56 gray. Assuming that the tumor each contained 10 to the power of 6 chronogenic cells, what dose would be necessary to maintain the 90% control rate if the tumors were allowed to continue growing until they reached a 1 centimeter diameter? Assume the growth fraction remained constant during the course of the treatment. So they have given the number of cells. They have given the dose, that is the total dose is what they have given, that is 56 gray. We can find out the surviving fraction for this in the sense probability is using the same formula. The probability is 90%. 0.9 equals e to the power of 10 to the power of 6 into surviving fraction. So putting that, log 0.9 equals minus 10 to the power of 6 into surviving fraction. So ln, this is ln. So ln of 0.9 gives us minus 0.10 equals minus 10 to the power of 6 into SF. So minus gets cancelled. SF is equal to 10 to the power of minus 7. So it is 7 log kills. So D10 equals total dose 56 into 7 log kills. So we need to find, it's not 7 into 7, 56 divided by 7 log kills, which gives us 8 gray. Okay, now this is the total dose, this is the number of log kills. Now they are asking if the diameter changed from 0.1 to 1 centimeter, that is, the tumor is a sphere, right? So it is directly proportional to diameter cube. So we have to this is growing, continue to grow until it reaches 1 centimeter diameter. So 0.1 cube 10 to the power of 3. So initially it was 10 to the power of 6. Additionally it is 10 to the power of 3, which gives us 10 to the power of 9. So currently with 1 centimeter diameter we have 10 to the power of 9 cells. So calculating the surviving fraction again for this, the other information would be same. So 10 to the power of at this point, if I put, it will be minus 10 to the power of 9 into SF. So SF will be 10 to the power of minus 10. So 10 log kills. So multiplying this with the D10, the total dose for this 1 centimeter tumor would be 8 into 10, that is 80 gray.